Now, I want to give a shout out to the strength of women. And this is one of the things that I just find so incredible about women. Often, women's strength is in the capacity to endure really hard things over a long period of time. We can just keep going and we can endure an unbelievable amount. And that's what this woman's face looks like to me. It's just this incredible endurance of like, I will get through this. However, I have to ask the question, just because we can endure doesn't mean we have to endure. Doesn't mean we need to go through things like this. And I think the answer is no. Unfortunately, the world agreed because they decided, okay, we have to start improving our methods. It wasn't right away, but they did start improving methods. And now they're getting more and more humane as time goes on, which is great. Zoe says the diagonal cut goes way back. I wonder how that came about. Well, we'll show you a picture of how much they actually open the chest to do mastectomy surgery a little bit later on. And it's a big hole that they create. It's not small. This scar is only the tip of the iceberg. So in the 1890s, the Halsted's radical mastectomy became the standard of care, and it stayed the standard of care for the next 70 years, which I think is incredible. So they took out the breast, the pec major, the axillary lymph nodes, fascia of rectus abdominis, serratus anterior, subscap, lat, teres major, all of them were removed. Like the whole thing was vacuumed out. So this is another early medical image that was used for the doctors. And you can see her eyes are open. Her eyes are open. Fortunately, at this part, they put a cloth over her face so that, she wasn't completely staring them in the face. But this is no joke. Like this is a lot of this is a lot for a person to go through. And all these muscles, they don't take out this amount at this day, which is great. Nancy asked, how did they discover the cancer back then? Probably it was very palpable at that point. They didn't have any internal imaging, so it was probably a very large lump that was felt on the breast, and they could tell like this is not supposed to be there. So it had to be large enough for a hand to be able to palpate. Now, in the 70s, we started making some real advancements and things speed up after the 70s. So in the 70s, we discovered a lumpectomy, which means you're only taking a portion of the breast tissue. You're not taking the entire breast. And they realized, okay, we don't actually have to remove all of this. If we just take a portion and then we couple it with radiation, then the woman's got a pretty good chance of survival rates. So that became a lot more common. And to this day, if someone gets a lumpectomy, it's mostly coupled with radiation. It's still the standard of care. Also in the 70s was a great time of discovery and openness in society. The first autologous flap surgery was performed. Now, just pop a yes in the chat if you know what an autologous flap surgery is. Just pop a yes in the chat if you know, or no if you don't. Yes, no, no, yes, yes. So a little bit of a mixed bag. So an autologous flap surgery means that a person is using their own body to recreate the breast. So in this situation, they started with a lat flap, which means they take the latissimus dorsi muscle on the side of your back and they pull it through your axillary area and they use it to recreate the breast. So that was the first flap surgery done in the 70s. In the 80s, early 80s, they started with the abdominal flap surgery. So that little, tummy pouch that women have underneath their belly buttons. They took that and then used that to recreate the breast. And that's still happening today. In the early 90s, we got our first skin sparing mastectomy, which means they realized, oh, we don't have to take everything off. We can just hollow out the globe of the breast so that it's just the skin on the outside. and then we can put an implant in, and that's less invasive for the woman's body because the implant can just sit in the natural pouch of the breast, usually underneath the pec major muscle, and it's less invasive for the woman. Now, current standards of care is a multidisciplinary approach. So they'll use oncology, they'll use radiation, they'll use traditional medical methods, also working with some other options, sometimes like physio or occupational therapy, not very often in North America. But what they have found is when they take a multidisciplinary approach, the survival rates are much higher. So now the 5-year survival rates are 89%, which is amazing because in the 40s, they were 25%. So we have gone up a ton in the amount of knowledge that we have, the invasiveness of the surgeries, and the survival rates have gone up substantially as well. So just pop a yes in the chat if that's moving for you, if that's like, that's an interesting history. I mean, women have gone through a lot over all the years, and knowing what, our generational history is, I think is really important, because part of what we can do is help heal that trauma that people are carrying in their body, whether it's from this life or generations before. If we're offering non-judgmental care, it can go a long way towards releasing emotions from the body, helping people overcome very difficult states. And if you feel called to do that, just pop a yes in the chat. If you feel like, I want to be a part of the solution so that people are not suffering in ways that they are currently suffering because they don't have access to the standards of care that would help them get out of chronic pain and movement restrictions. Yeah, definitely want to be a part of the solution.